Port Moresby, a city of, well, we don't really know how many people, do we? Because over the last few years, hundreds of thousands of people have been resettling here from just about every corner of Papua New Guinea. And as the population grows, so does the number of germs who live among our cells.
Infectious diseases are predominant in PNG. They are the commonest cause of medical problems.
But how much do we know about these organisms that have been part of our ecosystem for millions of years?
Germs are actually part of our body. It is when they are exposed to antibiotics or stuff like that, they tend to mutate.
In this episode of Life in the World, we will try to shed light into the world of infectious diseases, because it is hard to understand something that escapes our naked eyes.
The understanding of all this started in the 19th century, and there are a few key figures. There's an Austrian guy called Semmelweis who worked out that doctors were transmitting something from one woman that they were looking after having the baby to another woman when they examined the woman without washing their hands. And so the doctors who washed their hands, their patients didn't get sick. The doctors who did not wash their hands, their patients got sick. So Semmelweis thought about this and said, there must be something that in that woman who's got the sickness of after the baby comes out, there's a disease called puerperal sepsis. And without antibiotics, you die. And then eventually Pasteur, of course, who started to see things down the microscope. And so that all the jigsaw pieces started coming together, and the theory of infectious diseases was born.
Having understood that germs were the reason behind a lot of the deadly illnesses affecting 19th century societies, was just the beginning of a long journey into the world of infectious diseases. But how equipped is modern medicine today to trace them when they come into contact with our bodies, and what can we actually do to get rid of them?
So my name is Gabriela. I'm Dr. Ak. I'm a general pathologist, but PMGH Microbiology Lab is the only clinical microbiology lab in the country. We do all the samples, and then we go on to identifying them, and then further on doing antibiotic susceptibility testing to all the organisms that we identify from various specimens that we receive from our patients.
The basic appearance under the microscope is when it's a gram-negative organism, it will appear red. And if it's a gram-positive, it will appear blue or purple. And after testing the bag with the drugs or the different antibiotics, then we pass the results to her. And she's the link between us and the doctors treating the patient.
This is a wall poster on different kinds of parasites. These are protozoa. These are helminths in the intestine. Yeah, see, it's like a little snake. What is it called? Hookworm.
Germs are actually part of our body. They are germs that are good germs because we benefit from them. We have mutualistic relationships, which means that they're living on us, benefiting of a few nutrients from our body, and at the same time, their byproducts benefit us. And it is when we don't take care of ourselves, it is when they are exposed to antibiotics or antiseptic, stuff like that, they tend to mutate, and then they become pathogenic. Everyone's prescribing themselves, getting themselves on amoxicillin. They're selling it on the streets. 3 capsules for 50 toya or 1 kina thereabouts. That's why we've actually came up with the resistant organisms, which is very difficult to treat in this hospital. We have a lot of people dying in ICU when they could be treated, but they can't because those bugs, we've exposed them to antibiotics and they've actually mutated and now are more resistant to what we have available. So that's a very real problem for us right now.
And where do they buy these antibiotics in the street?
Probably from our medical supplies.
The spreading of drug-resistant germs, or superbugs as they are commonly known, is becoming a major medical issue in PNG. Illnesses like tuberculosis or sexually transmitted diseases, among many others, are becoming increasingly difficult to cure, and the problem seems to be getting worse with time. We decided to talk about it with Marielle Sander from the United Nations Population Fund. We got you out of the tower down to the street level.
I brought this just in case you had any more questions.
Okay, what's in there?
This report is a review of everything that has been done on condom programming, campaigns on family planning for condom use in the past 10 years, so that we could learn what is working, what's not working.
Right.
So we are planning to use this information for an upcoming campaign, exactly to address sexually transmitted infections.
Very good.
I grew up in Papua New Guinea. I wasn't born here, but I came here when I was 10 years old. And I lived in Lae first, and then Goroka, and then a little bit in Port Moresby. And I feel very strongly for Papua New Guinea, and I've seen the changes take place, and it's quite shocking. Sometimes positive, sometimes less so. Moresby, when I was here. There's more settlements now, there's more movement, there's more people. And that's why the collection of data, numbers, statistics, it's all very important, and we need to introduce that into how decision makers work. And so you get the situation where people are easily manipulated to believe one thing or the other, sometimes things that are not good for their own well-being or their health.
According to the UNFPA, there are nearly 2 billion young people around the world, and the majority of them live in the Asia-Pacific region. But what about Papua New Guinea? Who is really monitoring this youth bulge? Especially in cities like Port Moresby, where young women have been resettling to from every corner of this diverse archipelago.
So thinking about the condoms now. So trichomonas transmission is slowed, of course, but not really prevented by condoms. Chlamydia, it's slowed and prevented most of the time, but still the chlamydia will escape more. Gonococcus, transmission again is very high. So it's possible to get gonorrhea even if you use a condom, particularly if there's a whole impasse behind the sex and condom come out with this. And why do people leave their villages and come to Port Moresby, the city of young people? Because they don't want to be constrained by all the rules and regulations and social customs and hard work pleasure. So they come to Moresby, not find him boyfriend, girlfriend, quick time straight there.
In your own opinion or point of view, what do you think should be done to kind of clamp down on the number of cases, or what would you like to see happen?
So, A, abstinence. Don't start having sex until it's the right time to have sex. B, once you've decided to start having sex, this is the one for you. Be faithful. C, if you have sex outside these guidelines of A and B, use a condom, please. Now, if we did that, there'd be no transmission.
Adolescents, men and women, they don't understand the basic knowledge of sexual and reproductive health. And this is a crisis situation in Papua New Guinea today, especially when the population is so young. We have to do something. We have to get a review of the adolescent health policy. We need to do a big family planning campaign for the country. We cannot put our lives on hold because of COVID. We have to deal with COVID, and we have to deal with addressing the health situation, particularly sexual and reproductive health in this country.
We're now here in the gynecology ward, which is the ward for women who are having women's sickness type problems that PNG women suffer from, is infections of the genital tract. And particularly their partners may give them an STI type of genital tract infection, either chlamydia or gonorrhea. And these two STIs are very nasty bacteria that can cause damage to the woman's childbearing organs, and particularly the fallopian tubes which carry the sperms up to find the new egg to start a pregnancy. So we're now going to go and see if we can find a poor woman who is prepared to tell her story. We'll see. Of course, this is a very sensitive and somewhat embarrassing condition, and women feel quite challenged by the fact that they can't get pregnant. It's a matter of some social stigma in some ways, and women get divorced because of this issue.
So me stand sick in 1 year. Maybe in pain start me bed me big pain come up last year, August.
Okay.
Then me been come here. I think before I must stop, but then must I the body or me no so.
Yes, you talk straight.
Stop come na him. Me love stop lo wet. As 1 week number. Go stop him. Me glass ki mo lo one sick lo me but. All not to me all work to control him all kai na dislaga intas. Me sa feeling proud. I run, sweat. So go lose weight together. Just last year.
I'm here with the patient. She's been referred from the emergency department a number of times. I think she's told me that at least three times that she's ended up here in the gynecology ward. It's because she's having recurrences of very severe pain down in the bottom of her abdomen or tummy, and it's unbearable. And she gets some medicine, it relieves it a little bit, and then she gets sent home to complete the course of the medicine. But not long after, it comes back. Ellie's got one son who is 24 years old, and she's with the second partner for 13 years, but unable to get pregnant. And she's had a lot of pain in the last many years, 10 years or more. And her periods are painful, everything's painful, and she's now suffering from an episode of increased intensity of pain, and that's why she's come to the clinic. There's the bladder, that sort of tent-shaped structure, and that's the uterus there. And as we come up into the upper parts of the pelvis, we see she's got this enormous mass. So we're looking at the mass in her pelvis, which I would say is mainly an inflammatory mass, but it might have some pus. It might actually be an abscess as well. But it needs to be, she needs an operation. She's got a temperature of 38, a pulse of 120, so she's really quite sick. You feel him or same sick malaria, yeah? You feel him? How much days now?
Last 2 weeks.
2 weeks. Come. So Ellie's problem started when she was with her first partner. And this is the typical story of chlamydia. So you don't feel very sick when you get the chlamydia, but the chlamydia slowly but surely damages your tubes, or the tube that carries the sperms up to so that they can fertilize your ovulation. So she might have gone and got some treatment 30 years ago. Someone gave her some azithromycin or some doxycycline or some appropriate antibiotic like that. Then they killed all the chlamydia. But the medicine does not repair the damage.
Minun saken tripleman. Yeah, steady or kind of 35, 40, close to already 40. Maybe start 18 years time. Probably 40 million. So 6 years is a more plan, so I'm so jealous of me, like we story before. I'm jealous because I can't crossfire nothing. I'm sort of, I'm all man blue, I'm all boyfriend blue, jealous nothing. Now, I go far and then it's all man, I even remember fighting me too. I was 6 years, Mr. Nothing. We go, Maggie go school, and we look at saying walking weird, so you know, feel good, lost up more one time. So also me talking with somebody, me lose YouTube on blood time. You know, feel good, so me YouTube, just, you know, just call up nothing, or just now second man.
You talk Savilo. La boy to one?
I'm not talking, Haram Tas.
Sorry.
My blood tox allergy, so and bacterial something come, but then doctor, but then doctor see me all checking me lot I'm lawyer. All carry go inside low one in my skin. Because inside low bell blue you talk him hot, you think I'm hot, names are come on throat blue, hot test just come on throat blue. Sen good play talk say lol. Just wish you some.
Feeling pain? Fix that pain? In no big blood for months.
Come. Sorry. Okay? Narap la gumi or rausim pilis or stop yet? Pilis pilis. Tupla now. Tupla go out pilis. Okay. So operation mi play painim try pla book straight also mi talk here by mi painim yeah. Stop long left side. Left side play yeah. So mi play rausim or susu na karma produce la book yeah play rausim. You walk like kiss him some too hot, he come up long head play you or feel him. You know too much, huh? Okay, thank you. Baby spec you're right, so I think by looking normal sigmund and then we play like him through by paid, he go down, like go finish, huh? Yes. So I think by finish time sigmund he finish next year. But big play pain, past time he walk the feel him long and by not now because we play rouse him all. Place he got sick and rouse him is la book. Okay, thanks. Messages to all young people, never to get yourself into the situation that Ellie found herself in, leading to the awful, more than 20 years of pain and suffering, ending up with a very major operation to save her life. If you get to know lots of boyfriends or girlfriends, get to know them really well before you decide about the one who might be the right one for you. Make a good choice. Morning, Steret Ellie. Hey, you look as a narpla Mary. Not gonna bag pack up in this. Yes, so me no work the weekend, so me no looking me Saturday, Sunday. But you change the weekend, yeah, nah. Start feel alright, huh? Okay. Good blood through. So you got toilet finish. And stitch is stop yet. So by you come back long. Trinde, long clinic, long all Mary la tamblo, long 1 o'clock or something. By me house him stitch play you.
Bam jawan bam itu wasem. Now you come was the milausik na ilukim. One can pain us. Suffering we been go through long. Good Lord. One more boy. Kalau good dressing long him. Good la shoes etra is wearing or how am so walk about how am so drink na stand up na dance. Or one am pain no good la. You scaling good one am good la man. By look at you na by siran good la bien time li. No kan go to yes long em na. Osem ulang like doctor to ke. Condom em stop. Marasin to stop. Na choosing right that na bli. Na no kan make him nothing about. Kind of some doctor to finish. Time Wednesday me come outside, we stop now. O katol Mary go inside finish na me about tupla Mary should stop outside. Now me pray awesome. Me go inside me like him doctor Molata sol by looking me na save me. Na sla pray for me. True.
Thank you. Thank you, Ellie. Yeah, there was. We give you a clinic Wednesday.
Yes.
Thank you.
Thank you.
Good.
Thank you, sir.
Get your stuff.
Cambia il vento, cambia il tempo, fumo negli occhi e si fa sera. Mentre cammino lungo il fiume, tirando sassi al mio cane, un'aria fredda viene dal nord e nel mio petto